As we continue to cover President Biden's first 100 days, today we now focus on health care. In his first few weeks in office, the president has taken executive action on a litany of issues as he tries to undo a lot of the damage done by the Trump administration. New president, he's made moves on climate change, LGBTQ rights, racial equity, immigration, COVID, and the list goes on. President Biden has also signed an order to shore up the Affordable Care Act, and we know how he feels when it comes to Obamacare.
Ladies and gentlemen, the President of the United States of America, Barack Obama.
That was at the signing ceremony for Obamacare, his former boss's signature achievement. Now, 10 years later, believe it or not, President Biden, he's reopened the exchanges so more people can sign up, and he's restoring some of the things that Trump had whittled away, so more people now can have access to coverage. So let's get into this a little bit more. Larry spoke earlier today to Congressman Raul Ruiz. He a Democrat from California, and also an interesting perspective given that he's an ER doctor.
As you know, President Biden, he's been moving to shore up Obamacare in the wake of what the Trump administration did to it, attacking it for 4 years, basically trying to get rid of the whole thing. I want you to take a listen to what the president just said from the Oval Office, then we'll get your comments on the other side.
There's nothing new that we're doing here other than restoring the Affordable Care Act and restoring the Medicaid to the way it was before Trump became president, which by fiat he changed, made more inaccessible, more expensive, and more difficult for people to qualify for either of those two items.
So does that go far enough for you?
Well, first of all, let's understand that in the middle of a pandemic where people have lost their jobs, where they're struggling, where they're getting sick in the tunes of millions of people, that the Trump administration was encouraging the lawsuit to entirely eliminate the Affordable Care Act. So this is good news. And being able to strengthen the Affordable Care Act so that we can immediately provide relief for those that millions of people who have lost their jobs or that are infected and cannot afford their care is of vital importance. In addition to that, we need to address the chronic healthcare expensive cost issues, and that will subsequently come along, including his campaign promise of working to expand the Affordable Care Act with a preferential or a public option that other people can choose, which would be more affordable.
You're head of the House Hispanic Caucus, and you've been one of the leading voices trying to get the vaccines to communities of color who are oftentimes, let's face it, just left behind. There's inequities with the distribution of the vaccine. Tell me about your efforts. I know that you just visited with farm workers where hundreds of those folks got vaccinated.
Yeah, well, I tried to sound the alarm way back many months ago before the vaccine was developed, that if you rely on a broken system that has failed communities of color to address equity, then you're only setting yourself for failure. We have underserved communities that lack physicians, lack clinics, lack the resources to undergo these vaccination campaigns into communities. So that's one. Two is that the approach of doing vaccination clinics at big hospitals or big centers doesn't work for the hardworking, high-risk essential worker and the poor, like farm workers, that may not understand the system, that don't have the broadband capacity to make their appointments, that don't have the time to stay on the phone for hours at a time, and they don't receive the language, the information in a language that will help them navigate the system. So we've been pushing very hard to create the funding and resources into the underserved communities that have been hit the hardest with innovative ways to bring the vaccine and testing into those communities through mobile clinics, through collaborative approaches with nonprofits and healthcare districts and public health workers to take the test and the vaccines to the community, whether it's at trailer parks, whether it's at churches, at schools, in order to maximize the highest risk individuals to get the test and the vaccines.
So speaking of some of those larger sites, Dodger Stadium doesn't get much larger than that, not far from your district, as a matter of fact. And over the weekend, anti-vaxxers actually shut down people trying to go in and get the vaccines. And these nuts are preventing people and just spreading fear and fear-mongering. How big a concern is that for you, that people are just going to be scared to take it, especially with it being exacerbated by people like that, so publicly doing it?
Well, one of the barriers to this entire pandemic response that has been hurting Americans and prolonging the response and putting people in jeopardy has been the constant misinformation that's out there. And when that misinformation is subscribed to by leaders in authority that don't promote good public health, scientifically based precautionary practices like mask wearing, washing your hands, physically distancing, and now the vaccine, which has been proven to be 90 to 95% effective in preventing severe illness, hospitalizations, and death, then that puts in jeopardy and harms our fellow Americans. So we should do everything possible to mitigate that misinformation and really talk the truth through the scientists, the public health experts, to encourage everybody to get the vaccine.
Not to the COVID relief bill. You're going to have a vote on it once it hits the House. And so far, President Biden, he's showing a willingness to negotiate with Republicans, bringing them into the Oval Office. He's trying to cut a deal. But do you think that any of your friends across the aisle will play ball with the president, or do you think it's going to have to be Democrats and Democrats alone?
Well, you know, the best predictive behavior is their previous behavior. And we knew that during the Affordable Care Act, where they cried foul every step of the way on bipartisanship, President Obama bent over backwards, made some changes that were not very popular with Democrats in order to appease them. And at the end of the day, they all voted against it. So having that lessons learned, I think that the major priority right now is to bring relief to the American people, to boost our economy so we can build back better and save lives and get through this pandemic as quickly as possible, because we're in the middle of a public health crisis where over 400,000 people, soon 500,000 people will succumb to this virus. Millions more suffer the symptoms of this virus. And there will be opportunity for Republicans to offer their amendments, to discuss this in committee hearings. But at the end of the day, if they're going to vote for it, they will. If not, they won't. But we can't wait, because people are suffering and we need to make government work for the people.
And speaking of the severity of this thing, President Biden's COVID task force, it just warned that the next 6 weeks are going to be pivotal if we're really ever going to get on top of this thing. We have the new variants, we have the vaccine rollout. It's picked up a little bit, but it's still slow. Do you agree with that? I know you're an ER doctor as well, so you have a unique perspective on it.
I do agree with that. We have some things that are working for us. Right now, the hospitalization rates throughout, for example, the state of California and other hard-hit states are actually coming down. So we're starting to be beyond the peak of the holiday season gatherings. We also are starting to see a ramp up in vaccinations, with more vaccines being purchased by the federal government, developed and delivered by the federal government. And we're going to see new vaccines come to market from Johnson & Johnson, Novavax, and others. So the vaccination rates will start to go up, but we're in a race of time. And why do I say this? Is because we have a very big concerning threat, which are these variants. And some of these variants are shown to be more infectious, meaning more people will get infected easier, and therefore the probability of more people dying will probably go up. And some of these variants are more severe, with more severe health damage to the host or to the individual. So in order to combat that, we're running against time to do the genomic sequencing so that we can understand the vaccines, whether they work, whether they need to be modified or not for those new variants. But the best way to combat that is to eliminate the probability of the virus going into a host by vaccinating those hosts and ending it there. So we really need to do an effort to make sure people understand the urgency, that we're in a race against time, and we need everybody to do everything possible to get vaccinated.
Thank you for your time, Congressman. Appreciate it.
Thank you very much.